Now, if you look closely here, let me have that pencil right there, that little eyebrow pencil of mine there.
This one?
That's perfect.
Okay.
I think that might be a permanent.
That's a permanent? Oh, I don't think we want to use that.
Oh, this is not permanent. This is my eyebrow pencil.
Remember, he said it wasn't. Has nothing to do with me.
So this is her cheek form shadow that you don't want to inject. This is where she's getting her highlights from, is this little shadow. And it's hard to see on a photograph. You can see her shadow. You don't want to inject that because that's her youthful shadow there. So you can see it on this side too. So I actually purposely draw that in so that it just takes your eye away from not injecting those.
Where's my voluma? Right here.
That's where your makeup artist would do a little bit of their work to make this shadow here stand out. So this stands out as a highlight.
Okay. I'm injecting over here, guys. What do I inject, superficial or deep? Which one?
Or you could do superficial.
Oh, either. Thank you. God, there was a shoe that was coming off already. I was getting nervous. Yes, you can inject either superficial or deep. She's young enough that you can get away with both. But I told you my preference, when I do have the opportunity to put it on bone, I do it. You got it. So we're going to inject over here. This is just to fill up that little irregularity that she has. You can see my injection over here. I'm going to pinch the skin. As I pinch the skin, I'm driving the skin up into the needle, and the needle's in. Did you feel anything?
I mean, not really.
Not really. I'm using a 29 gauge over here because I didn't get a chance to blend this stuff down, and I'm going to be very gentle with my injection. I'm going to release and lift a little bit. Why do I do that? I don't know why I do that. I used a very small amount just to go ahead and to fill in that little defect that she had.
Essentially what you're doing is lifting that area of deflation. As you lift it just subtly, and then you fill, that filling creates lift.
Right.
That's what
You
happens.
know, we were doing this because Kent and I were talking about lift and fill, lift and fill, lift and fill. And what ends up happening is when you repeat this in your head, your hand starts to do what your head's thinking. And when I was demonstrating one time, somebody said to me, "Why are you lifting with the needle?" I said, "I'm doing what?" He said, "You're lifting with the needle. You release and you're lifting." And I realized it's because what I was saying in my head, I started to do with my hand. But think about it. If you're in the weightlifting room and you want to go ahead and do a bench press, you got to push that weight all the way up and then lock your elbows before you bring it back down again. But if somebody is spotting for you and lifts the weight up and you lock your elbows underneath it already, you've done very little work. If I wanted to lift my sleeve, I could stick the needle underneath and let the product fight to lift my sleeve, or I can use my needle to lift the sleeve and let the product ride right up underneath it and just support it like a tent pole. And I found, again, it's all empirical, and you might say, "Oh, that's a bunch of BS. I'm not going to do it in my practice." But I found that I'm using less product to be able to suspend those areas. And the less product that I use for this area, the more I have to use somewhere else on her face. Okay? So I'm going to do this very quickly because we want to get on with it. But we have here and here, right? This is it's a vertical line coming down. I sort of eyeball it, saying I got to come across over here. This is about where her apex should be. I'm going to fire in another needle right about over there. I'm on bone. I'm injecting slowly. Never be in a rush.
Find a lot of even really good injectors inject the apex way too low and way too medial, and your eye doesn't like it.
If you're in a rush, slow down. Go slower. It's when you're rushing to get home in your car that you're going to get into an accident. It's when you're rushing in the office to go ahead and to fire stuff in very quickly because you want to get somewhere that you're going to get into trouble. So I force myself, when I know that, oh my God, there's 5 patients waiting, believe it or not, I force myself to inject even slower than what I want to because I know that I'm already in a hurry mode, and what I think is slow is probably about what the speed is that I should be injecting. Okay, we got to feel where her temporal fusion line is over here. We got to get you off this table because should be somewhere about over here, one up, one over. I can't see anything. Looks like there's a little something there, but we're going to find out in a second. Small little stick, 3, 2, 1, pinch down in, finger behind. I'm slowly injecting over here. I'm just going to put in a small amount to try to balance out the eyebrows. That right eyebrow is going to come down a little bit.
See, he's actually intuitively holding the brow up with his index finger. He's holding it so it doesn't go above where he wants it to, but he's also just instinctively holding the brow up. which is then creates a little better result. It acts like a
No bruising, no pain. She's got to listen to me talk aesthesia all the time. I mean, it's all about the experience. She can go out right from here right now and meet her friends. She's going to look great. She's going to have those light reflexes that are bouncing off. She'll put her makeup on almost immediately. If it's a 29, a 30, or even a 27 gauge, I allow them to put makeup on about 20 minutes or so, 15 or 20 minutes afterwards. And, you know, because they'll sit with a little bit of ice just to take away the possibility of a little bit of swelling, and off we go. You were an amazing patient, by the way. You deserve a hand from all of them because you've been sitting. Can I have a cleanser, please?
Those injections really were painless. He's amazing.
It's just taking your time and like I said, giving a little flick. It depends on the product that's being used there. And here we go again. She had Resty Silk put in over there, and Resty Silk responds quite nicely to hyaluronidase.
Nice.
So I would pull up probably about 0.2 of 150, which is 30 units. And I add in some lidocaine, and I put little injections. I might not use the whole thing, but the whole total here, I might use maybe 10 or 15 units of hyaluronidase, and it should do the trick. If
Where would you put them?
exactly where the product is.
I'd use
You
the
know
whole-
where you injected
I'd
it.
I'd use 150 units.
Really?
Then
You'd
I'd
go after?
start over.
Yeah. See, because it depends. I mean,
That's
you
what
can
I
do
do.
that. Yeah, you can be aggressive and do that and take everything out, or you can try to be a little. It depends on the patient that you're dealing with. I agree with you 100%. Some patients, if they're disappearing on me, like if I was to do it today and not see her again, I'd probably want to melt everything out and then let her take another crack at it on her own. But if she was a patient in my practice, I try sometimes to melt it down a bit and not lose the result, especially in a tear trough. They come back and they're all of a sudden real tear troughy again. They get upset at you. But you said, I just took out the bump that you were bothered about. Yeah, but now I have my crease back again. So then you have to fill them, and they bitch about the fact that you're going to charge them for the fill, so you don't charge them for the... So you get yourself into a circle like that. I'm a little more conservative with that. But for the more robust products, the products that are higher cross-linked, I use my 1,500 unit per ml. Because you will not be able to... you won't be able to melt out Volbella or Volift or Voluma with the 150 unit product. You need a little bit of higher concentration. Didn't bruise you? There you go. You're about the same height now. Pretty damn good.
Yeah,
I'm happy
very
with
good.
that. Like I
Excellent.
said, I would do piriforms on her a little bit just to soften that up. And I think that would be great, but we got the
Lengthen the
eyebrows
nose-
sitting
lengthen
pretty
the
much
nose a
where we
little
want
bit.
them to. She's got a nice apex on that cheek too. I think you're doing great. We just, to be honest with you, the total amount of product that I used on her is 1 cc of product.
Wow.
Okay? But she didn't need a lot. You knew when she walked in that she was only going to use maybe 1 syringe. And I did use a little bit of
Just,
Resty Silk
alcohol.
over here, which I would use if I was to redo her lips.
Thank you,
And the
Mr.
Resty
Baker.
Silk
Gosh,
that I
you're doing a
used
great
over
job.
here was really 0.1. And I have a whole, sorry guys, I have a whole sterile syringe to use on the next patient because I never touched her with that syringe or with the
Okay.
needle.
Dr. Swift,
Yeah.
just had a quick question for you. Just wanted to make sure when you're mapping out the temple and you draw your line, the temporal fusion line, you are using the orbital rim as your landmark, I would imagine, not the edge of the brow, because some people's brow lies below the orbital rim.
Correct. It's a bony landmark, not a soft tissue landmark. So the bony landmark is you're going up the temporal fusion line 1 centimeter, and you're paralleling the orbital rim bone 1 centimeter, not the brow. The brow might be down there, the brow might be up here, right? So it's 1 centimeter up from the orbital rim, not from the brow, 1 centimeter up and 1 centimeter over. Does that make sense?
Yep.
My personal technique in treating a tear trough is to give it back what it lost, which is volume. I told you I don't like to put all the volume in on the tear trough on a deep injection because of the way the muscle is designed to contract. It's tethered here, it's tethered here. Means I'm going to be injecting into muscle, not underneath the muscle. And when she squinches like this, she'll come back 3 or 4 months later because she squeezed the toothpaste in the middle, and the stuff will come down and form a little ball over here and will Tyndall. So my technique is to use micro droplets of product. This is what Kent showed me originally on his technique. Micro droplets of product that is all along the orbital rim. And then I'm going to try to do something and see if I can lighten her by putting in some product just underneath the skin with a 30 gauge cannula. That'll be fun. Probably bruise the hell out of her, but it'll be
Got any
fun.
Q-tips there?
You have nowhere to go tonight, do you?
Now,
That's what I always ask patients when I'm
Dr.
doing tear
Swift?
troughs, because your chances are you might bruise them there.
so Dr. Swift,
Yep.
you watch her.
Go ahead, let's hear.
Smile a little bit. Smile
Sure.
A little bit. Okay, relax it. See right here. See this bubble?
Sorry, buddy. What's that? Yeah.
It's got juvie there.
Have you got product in there already?
Here, medially.
Medially, huh? I got to work around it, huh?
You can take it out.
I can take it out and put the new stuff in at the same time. I know we have hyaluronidase, but I tell patients, they say, can't you take it out and inject at the same time? It's like opening up the sink and the tap and the drain at the same time. It's just, it's going to eat it up. So you have to do it in 2 stages. No, I have a pair of gloves here.
Injections.
I have hyaluronidase.
No, how long do you wait in between the, if you inject the hyaluronics before you go ahead and again inject the filler?
Well, like I told you, when, tear troughs are these things do poorly. This is why I undertreat tear troughs all the time. And it's a tough thing to do as a demo because the patient isn't going to show the 100% result. And probably I'll try to get 100% on her, which really shouldn't be the ideal. But because she has a little product in there, I'm going to try to cover it. People say, why don't you just give them 100% of the result? And those patients, the 1 in 10 that come back that have a bulge, you treat with hyaluronidase. But hyaluronidase changes the product into water. What's the problem for the bulge in the first place? Too much water. You're now adding more water into the area, and the lymphatics are overloaded. They get a festoon. Then you have to hold their hand for a week and a half while you give them ice compresses to get rid of the festoon. I got to tell you, as a plastic surgeon, it's very difficult for me to operate holding somebody's hand. So I can't hold my patient's hand all week long, and I don't want them calling every day saying, it's still there, it's still there. So I prefer to undertreat and work it up. I treat the entire face and tell them, your eyelids are going to look like they're still wanting something. That's okay. It'll let the product work. It'll do it on its own. Come back in a month and a half, and if there's still a little bit left, I'll top it up. And that's when you peel off a little teeny bit into a BD2, and the rest of the syringe you don't waste. It's still good for another patient, and you adjust that little area. That's how I personally do it. Again, if you think that makes sense, if you don't, that's all. Always. That's me around the eyes. I just don't trust any product unless it's a 50-50 blend around the eyes, guys. I'm sorry, that's just me. I use Silk. I use Belotero Balance. I've used Volbella. I've used all the company's products. Juvederm, only Volbella the Vicross. I will not use Ultra Plus. They know I've said this before. It is a mistake to use that product around the eyes because the Ultra or the Hyalocross science is amazingly hydrophilic. Ultra Plus will absorb 625% of their weight in water.
Teaching against
It's a very hydrophilic product, which is why it works so beautifully for lips and folds, because you want some water over there. But their Vicross technology, which we have Volbella, which is the mini Voluma. When I got Voluma originally, I didn't have Volbella and Volift. I was wetting down the Voluma and using it in the tear troughs, which they don't want to hear. But I was doing that because the Vicross has only 100%. Volbella 100, Volift 125, and Voluma 150% absorption. So it's much less swollen. But Bellator Balance works well with that. If you like Redensity, do you have Redensity here?
It should be about 10.
Redensity 2, which is a Teozial product, is a very good product. Resty Silk is an excellent product. You want the T1000 over here, the one that spreads. Resty's good. I would sooner use that. And you can wet it 50-50. You'll be fine.
We'll fix it for you.
Yeah, we were asked before if I've used anything other than local to blend, and I have used saline to blend, but I just love the local because the patients don't feel a thing. As Caucasians age, what happens is we lose an average of 0.8 cc's, almost a full syringe in our periorbita. Most of the volume comes out medially over here. You see sometimes a bulge as you get older, as the thinning of the skin is there, but we lose a lot of volume medially. And normally where she was younger and the apex of her eyes looking into the camera, Let's get you to look straight into the camera, which is somewhere over there. Good. Okay. Where the apex would have been very medial, it's now mid-portion of her upper lid. The apex moves laterally and causes what we call an A-frame deformity. So what we're going to do is we're going to try to correct that A-frame deformity by putting in a little more volume. I have some product. Again, it's just that it's prepared over here. Actually, I'll use the Resty Silk that I have over here, but I could very easily use Bellotero Balance, which I love for this area as well. I'm taking a 1 cc syringe, and I'm now going to put in about 0.2 cc's of my blend, which you can see, if it comes in a little bit closer, if you can see that it's the champagne stuff. Has little bubbles in it. Normally you use a larger trocar than the actual cannula, but I'm going to use a 27.
I usually use a 25.
Yeah. And what I'm going to do is I'm going to pick a spot halfway or somewhere above the bottom portion of the orbital rim. Can you see that? The bottom portion of the orbital rim and her brow, I'm going to go in somewhere in between, and I'm going to put a little stick in there. Are you okay? Fine, she said.
Most patients don't feel as much at all. It just looks like they'd feel it.
Okay. And I spin it like Kent does, because if you just stick and pull it out, everything collapses and you can't find it. I'll prepare this. Let's see if we're going to get, in case we get a little bit of bleeding. Don't let them walk out of the office like this, by the way, guys. Can I have a dry sponge here?
Hold on. Here she got it. She's got it.
Oh, you do?
She's on it.
You're on it, is right. It's not because they're going to look weird if they walk out of the office, but every 16-year-old is going to be in your office the next day saying, can you do that to me? They love piercings like that. So we're going to stretch the skin. Notice when I'm holding a cannula with my gloves that are not sitting on properly, when I'm holding a cannula, I hold it like a dart.
Yeah.
If you try to hold it the way that you're going to inject, it's very difficult to find the hole. I'm going to stretch the skin and balance myself. I'm going to ask my assistant, I want to make sure you guys see this. You can.
I'm going to take that out.
I'm going to ask my assistant to pull out the needle. Go ahead. We'll see if there's any bleeding or anything. I hope there's a little drop of blood. And I'm going to feed my cannula in. There.
There's not a drop. Just tap it a little bit.
Yeah, just wait it out. Okay, so here's my cannula under the skin. The reason that I choose this location as a lateral approach is because the bone is now protecting the inside of the orbit. I'm going to have to really go crazy to try to maneuver around the bone to get intraorbital because it's cantilevered over here. If I would have started my injection below, I very easily could have gone in too deep and gotten into trouble. Does that make sense? This is the way that I think these things out when I want to do these things. And then what I do, and I'm not even going to inject, but I'm very gently going to advance the cannula in a plane. Look how superficial it is. In a plane that's below the orbital rim. I'm slowly advancing it. If I get a little resistance, I'll put in just a little bit of product to what's it called? To anesthetize it, or even to cause a little bit of hydrodissection. Okay? And I'm already across where I want to be. You see that?
Inch and a half is just about right. That 30 millimeters is just about right.
And now what I'll do...
It's too short.
Yeah. I'll start, now look at what I'm doing. I'm injecting with the base of my thumb, and I'll tell you a story about that in a second, because there's always stories.
See where his pinky finger is?
And I'm going anti and retrograde very gently, injecting very slowly. I've injected now a little less than 0.1. Look at my depth. You can almost see the cannula through her skin. And I'm going to go down and I'm going to get it over there. I'm going to ask you to open your eyes now. Look straight ahead. Okay? You can see that I have to put some more in over here. Close your eyes. I'm going to come across over here. There we go.
And April will tell you that it's not that uncomfortable, right, April?
Am I hurting you?
No, not at all.
Most patients don't feel a thing.
You feel pressure and movement?
A little bit. It's just kind of annoying.
And what I will do sometimes, if I'm really nutso about it, I don't know if I can do it, I usually have a little clamp, is I'll unhook my... Because I usually use patients, I mean, we're doing it for demo that she's sitting up a little higher and I'm breaking my back doing this, but if she was sitting back a little bit, I would unhook my syringe and leave the cannula floating there, have her sit up and open her eye without having to reintroduce the cannula and see if I've missed any areas. I'm going to ask you to open your eyes again, please. Good girl.
As we talked earlier, the whole orbit, you want to undertreat because when they come back in a week, 10 days, 2 or 3 weeks, it actually looks much better than it did when they left because of the attraction of water and the molding, blending that's done. So he's pushing right on the orbital bone here, even though it's done very shallow.
I'm going to block your vision here for a second, guys. Open your eyes. Bingo.
Yeah. So I mean that's beautiful. So before she's got about 2% body fat, this girl. So
Open your eyes. And look
how
at
much
me.
do you work out there, April?
Yeah. So what I've done is I've tried to remove. She might need a little teeny bit over here, but looking at my finger over here, that's a girl. We want to see some volume in that area. Maybe I can coax it over without having to really
Where's your mirror, girls?
inject it. She might need a teeny little adjustment over there. I'll put in a teeny bit more. So that was 0.2 of 50/50, which is what? It looks scary, guys,
Nothing there, right?
but I got to tell you,
Yeah.
Empty?
I wish tomorrow, for those of you that are going to be hanging around and we're going to
Throw away
inject patients
the
together,
cannula, though.
everybody hopefully will
I'll
get to
throw-
do this. When you put in that little, look how nice that lid looks. Look straight ahead. That's it. That's what we want. You see? Do you see how the peak now is medial? The peak is medial. She has a contour that's following the eyelashes, and the other eyelid looks hollowed. Okay? It's a youthful look to see that volume. That's the idea behind it. It looks scary, but I got to tell you, this is easier than doing nasolabial folds. I swear. Okay? You just got to be gentle. You don't force the cannula to go where it doesn't want to go. I used a 27 gauge, which I would use. Are you okay?
Yeah.
Didn't hurt you?
No.
Okay, great. I used a 27 gauge on her because of the fact that I don't want to take a chance of bouncing off the bone and then perforating a globe, which I won't, or more importantly, puncturing a vessel. So I want a little more of a duller thing. And you saw that I put the syringe plunger down in my palm because I have more control with my palm than I do with the tip of my thumb. For the lower lid, which I'm going to do right now, very quickly, and then I'll end up injecting her, because we're 5:45. God, you guys are hanging in. Can I have a cleanser again, please? You know I'm going to ask for that. I'm going to do her lower lid now. Can I inject on the orbital rim, yes or no? Right, because the vessel is 5 to 8 millimeters below, but I don't want to put a whole bunch of product in there. You okay? Good. I'm cleaning this up. And I'm at a disadvantage over here because she has other product that's in here that's causing a little bit of bulging. So I'm going to see if I can actually cover it a bit. All right? Good. You can do whichever way you like. Want to keep it closed? That's perfectly fine. Okay. So I'm feeling for the orbital rim. I got to make sure that you guys can see this.
Yeah.
It's in the shadow again. I apologize. Feeling for the orbital rim. See how I'm stabilizing my needle, trying to find an area between the vessels that looks white, and she's going to feel a little stick. I'm on bone. You okay? Mm-hmm. A little pinch. I'm staying on bone. I'm injecting a small little bolus. Kent gave me this little thing that I don't have on me right now. That's a great little thing to use. And then I'm just going to pat it gently. Okay? And this is, again, the Resty Silk. But I could very easily use Bellatero Balance. I could use Volbella, which you guys don't have. You can use Resty plain straight up, okay? And it's my 50-50 blend. Okay? I'm going to give you another little injection. There's a big bloody vessel there that I can see that's in the way, so I'm going to come a little lateral.
I saw that.
Yeah. I'm going to put another little bit of product in over here, nice and slow. Beautiful.
How much are you injecting?
I had a total of 0.15 in my syringe, a 50-50 blend. I'm now at 0.1. So I'm using 0.025 cc's per bolus. Really teeny amounts because I don't want to overload the muscle with product inside the muscle. Once I get to the outer side over here, let me just adjust her mascara here. Once I get to the outer side over here, now the muscle is gliding on the SOOF. So I can put in product over here without worrying about it. Here we go. Nice and slow. So far we're doing great. We haven't bruised you. I tell patients if they have something coming up in the next day or two, I won't do this because this is the area that might bruise more than anything else. And we're going to do this over here just a bit. Okay. The thing that you have to be careful about when you're using cannulas, you want a good seal at the luer lock. when you're using a product like the new Juvederm products like Voluma, because Voluma is so cohesive, or more cohesive than most, what they've done in Allergan is they've increased the number of spirals at the end of the syringe. Instead of having 3, you have 5 spirals because they wanted you to really lock it in, right? The problem with 5 spirals is they're very close together. And if you choose the wrong hub on a cannula or on a needle, you'll crack it. Have you ever cracked one of those? Right. So you got to make sure that the hub is a very thin hub. For that, the TSK is the best. It's the thinnest hub. Okay?
So the other trick to that is to break in your hub by using the needle it comes with, and you just spin it on a little bit, and before you put your cannula on, and it seems to stop that splitting of the hub, because we had a big issue with splitting those hubs. So that solved that by just breaking on that little threads with a regular needle. Because most of these cannulas have an oblong base to the hub, and if they're a little too oblong, like Dermoscope is too oblong. There's a couple from Japan that are too oblong. There's a new company from London, from England, that's making cannulas that are round. They're amazing. They're great.
I think I just skewered that vein. We're going to see if I did or not. Oh, I don't think I did. I'm just trying to get you nervous, get your blood pressure up. You always bruise? Not on my watch. We're not going to let that happen. Okay. This comes off. I've used a 27 gauge needle as a trocar. Hi. I'm on video. I'm looking at you. You got the light on, so I must be on video. Hi, Mom. Just to drive me crazy, yeah? Bill Cosby, the old Bill Cosby,
Be careful now.
used to talk about the fact that he would spend so much time with his sons, taking them to football games when they were kids, taking them to practice as they grew up, and da-da-da-da-da, all the way through primary school and high school and college until they got finally onto a university team, and they were on TV, and sure enough, there's his kid, and this kid's sitting on the bench, and they zoom in on him, and he says, after all these years, the first thing the kid goes and says is, "Hi, Mom." He says, and I was the one that spent all the time with it. But anyways, okay, here we go. I'm going to pull that out.
Get out.
Let's see if she bleeds. Go ahead, don't worry. Oh, we're lucky. We missed it, but I can't see the hole now. It must
But
be
the nice
here.
thing about a 1-inch 27, it's not like a noodle. It's pretty firm, so it's perfect for tear troughs.
Okay. So I have a 30 gauge now, and I am running so superficial. Look at that. And she doesn't even feel it. It's a plane between the skin and the muscle. If you have to force this cannula, it's because you're too deep in the muscle or you're too superficial under the skin. Here comes the plunger down again on my thumb, and I'm very gently going to start to fill in back and forth over here. Look how slowly the plunger is moving. You want to look? It's
You don't
okay.
have to watch.
That's fine.
You do feel it going in?
No.
Okay. And I'm struggling right here where the tip of my cannula is where Kent pointed out that she has some
Product there, and she's
some
also got
product.
product
I'm
on
going
your
over the
side.
top to try to see if I can hide it a bit.
It's more on the other side or on the left side.
Okay. You see some over here? There we go.
A little bit right, yeah. A little bit below that. There you go.
I've used only 0.1 of product. I loaded in, I think, about 0.15. So it's a very small amount of product that I'm using here.
The other advantage of using cannula is where you need to, you can reach the apex much easier.
Bingo. That's just about where I want it.
And you
She
only
has
want
a
about-
little lacking over here.
You only want about 75% improvement.
That's it. I'm going to ask you to hold this for 1 second. So we'll look at it in a second. We're going to see if she lightens up a bit too. It's just such little painting with a fine brush. I'm telling you, my days when I do this stuff to me is like sitting in a field, in a vineyard somewhere in Italy. My friend Lee Gibstein drinking his wine. I'm looking at the grapes. And I have an easel in front of me and a canvas, and I'm just painting. And I'm painting with a fine little brush. If you have to do a little work, do a little brush. So here's the story. You notice that I put the thing down into my palm. Where did I learn that? This is the Carney story that people ask me to tell. When I was engaged to my wife, I took her to a carnival to try to win her one of those big stuffed animals. And I went over to the shooting range and I said, oh, this is easy. I'm standing here. The target is this far away. They gave me a rifle. They said, look, there's a little red square. Just shoot out the red square. Make sure there's nothing of the star. There's nothing of the red star left, and you're going to win this huge animal. Piece of cake. Guy passes me the rifle. I go and press on the trigger of the rifle, and all 100 pellets come out like this. I said, I see what they did. They jack up the pressure on the CO2 so high on these guns that you can't pull the trigger without all these pellets coming out. But I am a plastic surgeon. I was a resident at the time. I know what to do. I'm going to just pull very gently. Okay, so we're now $20 later, after $1. And the carney looks at me and says, buddy, you need some help here? I said, Guy, I'm dying. You got to help me out here. And my wife's tugging at me saying, come on, we want to go on the rides. I said, I'm going to win you that stuffed animal if it kills me. He looked at me and he said something to me that absolutely slapped me across the face. This guy that was in a wife beater, pair of jeans that were much too low, okay, he weighed about 8 pounds, gray hair and a ponytail. It's the only thing I was jealous about, gray hair and a ponytail, tattoos all over the place, maybe 2 teeth, maybe. Grade 5 education, probably. Looks at me and says, you know what you're doing wrong? I said, what is it? He said, you're using the big muscles of your forearm instead of the small muscles of your hand. That was like somebody taking a book and slapping me across the face. As a plastic surgeon, I'm a hand surgeon. I looked at him, I said, what? He said, you know, when you're in the Army, and then I understood where this guy was coming from, and they teach you as a sharpshooter, they never say pull the trigger. What do they say?
Squeeze.
Squeeze the trigger. He said, and he was right. Because the large muscles of your forearm are connected to the fingers by a pulley system, by the tendons. A little movement over here translates into a big movement on your finger. But the small muscles of your hand are directly inserted into the bones. And when you squeeze, you have little increments of motion. He said, take the rifle, put your finger on the trigger, don't pull it, just squeeze your hand gently.
That's why.
And I squeezed my hand gently, and 1 pellet came out.
What do you think about my temples?
Now it's a piece of cake.
Fine. I wouldn't touch them.
I knocked the whole thing out. It took me 2 tries, and I won this huge teddy bear, which my wife kept for 2 days.
So,
But it taught me that when I want to get control over small injections, I bury the syringe into my palm. Now, that's a difficult thing for a woman to do with a smaller hand, which is why we switch over to these little BD2s. We switch over to the BD2s because you can bury the palm in your palm of your hand. And I'm telling you that if I had a 1 cc syringe with the plunger almost all the way in, with water in it and an 18-gauge needle, which is very difficult to control, I could hang a droplet off of the end of it by squeezing slowly and making the droplet bigger and bigger. So for fine work, I would suggest that you put the syringe back into your palm and learn how to use it that way. A lot of the syringes are already made ergonomically to do that. If you're filling up a cheek or something, you can do this. But if you want really fine control, squeeze the trigger.
hey, Arthur,
Yeah.
ask him why she's got that blanching there.
So why does she have blanching here, guys? That's a little bit of the epi effect, which is giving her a little bit more whiting than I would like. But if you look at the contour, but that's fine, it's going to go away very quickly. If you look at the contour of that lid, it's a little too good, actually. It's been corrected maybe a little bit too much, but I've used a 50-50 blend. I think I'm going to get away with it. Okay. Total product, maybe 0.15 of total product, of blended product, which is how much? 0.75. That's why when I use these products, I used maybe 0.1. You can see a little blanching over here on the top here. I used a little too much epi, but that'll go away. I used here and here. I can do her forehead. I can do her lips. I can chase a couple of fine lines if I wanted.
No, we're not touching those lips.
We're not touching those lips at all. She's beautiful. I'm saying, but I could if I wanted to with 1 syringe of product. And that's why I tell you that when I do full faces now, I already have it in my mind already that it might take me 2 syringes to do a full face. You saw me on, these are beautiful women. I mean, come on, guys. This is, if you had somebody who's really deflated, so maybe you'll use 3 or 4 syringes at the most. And you'll say, well, people can't afford it? Bull. They all can.